Hi, I'm Dr. Adam Davis. I'm a chiropractic neurologist, and we have a patient here today who has a situation where she had a concussion and it's affecting her life. She's having trouble with speech. Are you having trouble with balance?
Yes.
Having trouble with balance, trouble with memory. So we're just going to see what was affected by her getting hit on the left side of the head. So we know that the left side of the head runs the right side of the body. So we can use range of motion to see if there's a discrepancy. So we're just going to check what we assume is her bad side. So we're just going to get a range of motion here. Would you say that's about it?
Yeah.
Okay, so that's about 85 to 90 degrees. All right, now we're going to her unaffected side. So we're going to see where that's at. Is that it right there? Okay, so that's more like 110, 115 degrees. So we can definitely see discrepancy there. So I'm going to go through and do my assessment on her to see if we can balance that. So the first thing we're going to do is see if her muscle shuts off when we squeeze it. Okay, so it's called autogenic inhibition. So this is supposedly her good side. So we'll squeeze this side, hold your arm in, don't let me press it out. And it weakens the way it should. That's a good thing. All right, now let's see if her affected side is working properly. So we're going to squeeze that muscle, hold your arm in, and it does not shut off. Okay, so that's two indicators that we need to activate this area of her brain or possibly her right cerebellum in order to normalize this. So we're going to see if moving her head makes this side of her body work right. Go ahead and move your head around for me. Good, relax. All right, press your arm in, hold tight, and it does. Okay, so we know we need to adjust the right side of her body in order to normalize her brain. So we're going to do that here real quick, and then we're going to reassess. So I'm going to start with her jaw. And we're going to add a little acupressure technique to help balance her nervous system. So go ahead, open for me. Close a little bit. Is that sore? Mm-hmm. Should be sore. So I'm going to tap on this acupuncture point here. This will interfere with the pain signal and influence her cerebellum on the right and cortex on the left. We're going to do the same thing to her sternocleidomastoid and her trap. Let me know where the sore spot is.
I feel like it's just all really tight.
The whole thing?
Yeah.
All right, we're going to do the whole thing then. Swallow for me. So we're going to activate the vagus nerve with her swallowing. Now she came to me because she said that her other doctors didn't know what to do with her. How many doctors have you seen?
2.
Okay. Keep swallowing for me. But this is the difference between going to physical therapist, medical doctor, standard chiropractic care. I do a lot of stuff that other physicians don't know how to do. That's why we get the results that we do. Good there? Mm-hmm. Okay. Now I'm going to work on a cranial adjustment here on the right side to help stimulate her right cerebellum and left cortex, giving us the right motor output on the right side. Go ahead, open for me. Take a deep breath in and out. Breath in. This is moving her spinobasilar joint on the roof of her mouth. Breath in. Air out. 2 more. Good. Last one. Excellent. Okay, now we're going to make an adjustment on the right side of our occiput in C1. So I'm going to have you turn your head to the left. Okay. Sorry, were you get pain right there?
It's just a stiff.
Stiff, okay. So we're going to bring the head this way. With your eyes, we're going to have you look at the corner of that poster. Keep your eyes locked right there, okay? Mm-hmm. Just let your head relax. Good. Now, for this one, we want to stimulate her right cerebellum, so I'm going to have her close her eyes. So I'm going to come around underneath, and I'm going to pull this way to stimulate the right side cerebellum. And let your head just relax there. Good. How's that feeling there?
Feels good.
Good. Okay, cool. All right, now I can adjust the other right sides of her body so we can do her ankle. Just let your ankle relax. Good. Your knee, your hip. All of this stimulates the right side cerebellum. Complex movements also do, so that's something we could have her do, which would be spinning the right arm and then spinning the right leg at the same time. So there are a couple things that I'm going to send her home with so her brain injury improves. Okay, good. Now I'm going to adjust the mid back here on the right side. Let me have your arms. Big hug. Let your hair out. And again, we're only doing the right side joints. Good. One more. Good. Okay. Now I'm going to have you lie on this side for me. Slide towards me a bit. Straighten this leg. I'm going to have you bend this up. So I'm going to adjust her tailbone on the right. So I'm going to have you drop this back, let your air out, and just relax here. You okay there? There, good. Okay, over on the other side. All right, bring that up. Now I'm going to adjust her sacrococcygeal joint on the right. Drop it back there. Just let this relax. Let your air out. There. Okay, now lie on your stomach. So another way we can stimulate the cerebellum is through vibration. So we're going to use this vibrocussor. I'm going to put it on the right side up here and see if it causes a weakness. Bend your knee, hold tight. Good, drop. Going to stimulate that for a few seconds. Okay, bend this up, hold tight. See, and it weakens her. So that's how we know that this therapy is actually going to help, but we just got to do it enough. Anytime you see a muscle change, you know that it's going to affect the body. And the nervous system is nothing but more than an electrical system. So we can flip switches in the body and see how it responds through muscle testing. So we'll see if we did it long enough. Bend, hold tight, press hard. There you go. Okay, good. Drop. I'm going to move down here. We're going to check this side. Hold tight. That's fine. Hold tight. That's fine. Last one. Okay, all that's good. So we know we stimulated the right side with vibration enough to balance her nervous system. So now we'll just recheck everything. Let me have you roll over on your back. So if we balanced her hemisphericity, which is what we started with, we'll see if now that her motor function is working, right? Giving us an equal range of motion and proper neurologic function. So again, I'm going to pinch the muscle and it should weaken. Press it for me. And it does. That's how we know that we balanced everything. Now let's check her range of motion. So this side was about 120, 115. So you know, actually a little increased. Okay, let's check this side. This was the weak side, the tight side. Holy cow.
Wow.
Isn't that crazy?
Yeah.
It's because we balanced your brain. So if you have a concussion out there or any sort of problems because you think it's neurologically connected, call us because we can fix these things.